Welcome to A Balanced Life on the Go. I'm Dr. Nicole Lindsay, your host on this podcast, along with Dr. Brian Jeanette. This is a podcast designed to help connect you to a more balanced life on the go. Each week, we will bring you simple, concise, and easy to implement ideas, tips, and strategies to help you connect to better nutrition, movement, and thinking so you can achieve balance in your busy life. Isn't this what life is all about? Trying to achieve balance so that we can be healthy, happy, and live to our fullest potential. We're glad you joined us. Let's get started.
Welcome, everybody.
Welcome.
Yeah.
So thanks for coming to our talk today. We're going to talk about blood pressure. What is it? What causes it? What are your risk factors for it? And how you can treat it naturally.
So our hope for this talk today is to give you some really easy information about blood pressure and some simple level things that you can do to try and lower your blood pressure naturally, keep it low, and make sure that the result of a normal blood pressure is a normally healthy, functioning body with no apparent issue involved with it. Uh-oh.
Lowers my blood pressure.
Just looking at a dog? Yeah.
Okay, so high blood pressure, what is it? It is a common condition that affects the body's arteries. It's also called hypertension. If you have high blood pressure, the force of the blood pushing or pressing against the artery walls is consistently too high. So the heart has to work even harder to pump that blood out of your body.
We all know what happens when we have to work harder to do things. We get tired, we get fatigued, we get burnt out more easily, and the system as a whole stops functioning as optimally as possible.
Okay, well, we can't see that at all, so I will tell it to you.
Yeah.
So your blood pressure numbers and what they mean. So your blood pressure numbers are broken up into two different ones, a top and a bottom. So the top number is your systolic blood pressure. This indicates how much blood is exerting against your artery walls as your heart contracts. So that's the top number, usually seen as 120/80. That's our normal blood pressure range. Our diastolic blood pressure, or the lower bottom number, indicates how much blood is pushing or exerting against your artery walls as your heart relaxes.
I think most of us know that 120/80 is normal, or they say 120/80 is normal. Actually, what 120/80 is, it's actually indicative of pre-hypertension. So we actually want to be at that 119 mark over 79 mark, which would be normal. A higher blood pressure or a pre-hypertensive blood pressure would be that 120/80 to 139/99 or 89. So the higher that number creeps up, that's where you start to get into that pre-hypertensive and hypertensive state. So the more consistently you see that number go high, and all of you, I'm sure, have been to your family doctor, have gotten your blood pressure checked, or you have a blood pressure cuff at home and you consistently check it. So you can see how that trend or what your blood pressure is over a length of time, not just during one particular event during the day. So you don't want to track just one number at one period in time where it's 150/90 and you have high blood pressure. You want to consistently track it and get multiple data points and average those out.
Yeah, absolutely. And when people say they have high blood pressure, it can be either the top number or the bottom number. Typically, the top number is what most doctors pay attention to because that is the force that's being contracted out through your arteries. So if there's more buildup, more resistance through that, that's the number they pay more attention to, whereas the relaxing number usually indicates higher blood pressure after the first number goes.
So, and this is exactly what we just talked about here. So we have that normal, less than 120, less than 80, that elevated 120 to 129, then high blood pressure. I guess this particular chart that we have has high blood pressure of 130 to 139. So they actually were a little bit more stringent on their numbers than I was during this particular talk. But that actually is a really good point to bring up. Because anytime that you do get lab work, anytime that you do go to the doctor to get your blood pressure taken, or they say, I want to just check your normal blood panels, they're going to give you a range in which that is normal. Now, the range that they give you, kind of getting off topic here, whether we talk about cholesterol, we talk about triglycerides, that's going to be a pretty wide range. And it might seem like those numbers are so far separate from each other. That's because that they are, right? That's because that they are. What they're doing is they're taking an average of, the million people that walk into their office or that walk into that lab. They take that average about what looks normal and what looks healthy for that average person. So because these are a little bit different, your elevated blood pressure might be 120 over 80. That might be your elevated blood pressure. But if you're normally in the 105 over 70 range, because it's now within that normal range, but that's not normal for you, right? Everybody has their own set state of normal. And that's why it's important for us to track those numbers consistently over a longer period of time.
So I found these statistics on the CDC website. I thought that they were really interesting. So having hypertension puts you at risk for heart disease, stroke, which are both the leading causes of death in the United States. Nearly half of adults who have hypertension, nearly half of adults have hypertension. So 119.9 million people in the United States have been diagnosed with hypertension, with a reading of 130 millimeters of mercury or higher of the systolic blood pressure and 80 millimeters of mercury or higher of diastolic blood pressure. Half of those people are uncontrolled and are not on medication. That's 37 million U.S. adults. That's a ton of people that are going around with uncontrolled hypertension. They might not even know that they have it. And high blood pressure costs the U.S. about $131 billion each year. That's in ER visits, that's in medications, that's in your normal checkups. And that's a ton of money that the U.S. is making on
I'm in the wrong
pressure.
network, for sure.
The wrong network, yeah. Absolutely. I also wanted to include this graph in here. So as we can see, the South usually doesn't get the best reputation in terms of health. But what I found interesting on this is that this graph is by age prevalence, not by who population-wise has it, but age groups that have hypertension. So the darker numbers are anyone above 45, which in the South, pretty common with that. But what I wanted to point out was in North Carolina, we're seeing more and more people younger that are coming up with hypertension. So in the 19 to 35 age range, which is really scary to think about.
Wonder why. So there's a lot of complications that are associated with high blood pressure. And what I want to do is actually, can we skip this slide for a second and we'll come back to it? Because there's a couple causes of high blood pressure. Now we put blood pressure into two different categories. We'll get into this in just a second, but we put them in essential or primary hypertension, and then we put them in a second category, secondary hypertension. Now a lot of these causes, now this is just like a physiological cause of hypertension, which, like, what does that mean? That means what is happening in the heart itself, for the cardiovascular system itself, that is going to cause high blood pressure. So two things, and the first thing is exactly what we know, exactly what everybody talks about. You get plaque built up, right? Like you go to the hospital, you're like, oh man, I had chest pains. I went to the hospital and they did open heart surgery, and I was 90% blocked. I'd had 4 stents put in. I didn't even know that my heart was 90% blocked. That's that plaque built up that happens, right? The second type of cause, the second physiological type of cause that we have in our heart, is those arteries get hard. So the tissue that's in your heart where the blood pumps through, that's called your endothelial tissue. This stuff is like very elastic. Like this stuff like stretches and moves, and that's what keeps the heart rate low. Like when your heart pumps, it like expands and like it moves very well. The more serious damage that takes place in the heart is when those vessels stop expanding and they stay shrunken. So as your heart pumps that blood all the way through that artery, it should expand and should, like blow up and let that blood flow through really easily. But as it pumps now, it's not going to do that. So this is hardening of that blood vessel. And this is actually the more serious condition that takes place, because this plaque takes decades to happen. This hardening also takes place to happen. But as that plaque gets laid down, what happens is your body kind of figures out a way to get around it, right? We still have some elasticity in those arteries, but as soon as those arteries lose elasticity, you're like Aaron Rodgers popping an Achilles tendon on the field. It's just going to pop, and you're going to have a major issue that's associated with that. So if we go back to the other slide, these complications that take place, these are all complications of that high blood pressure. And each one of these can be caused by one of those two physiological causes, either that plaque that gets laid down or the hardening of those arteries.
Yeah, and the blood has a harder time pumping through.
There are a couple things, particularly in this bottom corner, that we want to pay attention to. Obviously, heart attack and stroke, everybody knows that high blood pressure is associated with heart attack and stroke, right? Like your risk goes up with that. But one of the things that we don't necessarily discuss as often being related to high blood pressure is changes in memory, changes in understanding, cognitive function, and dementia that's associated with that. And
If that blood has a harder time getting to your brain's not getting oxygen. It's deprived of nutrients. So memory, understanding, learning, new skills, all of that is diminished because our brain isn't getting the blood flow that it needs coming from the heart. And we see aneurysms. That blood is having to pump so hard through those arteries that it can actually balloon out. And at that point, if the balloon ruptures, that's life-threatening. That's really, really scary. Kidney problems, again, the blood is having a hard time getting to those organs, so depriving it of nutrients. Eye problems, same thing with the aneurysm. Again, hard time with that blood getting to those arteries and vessels.
then, yeah. So this is what I touched on just a second ago. The difference between the two types of hypertension that we have. And I love this slide. I think these next two slides are probably the most powerful conversation that we can have about high blood pressure. Primary hypertension, also called essential hypertension. Now, this is that hypertension where you go to your doctor and like, I don't know, I feel kind of funny, I feel like I have chest pains, and he says, oh, you have high blood pressure, get on this medication. And you're like, why do I have high blood pressure? Like, what's going on? And there's no identifiable cause of this high blood pressure. So it's called primary hypertension or essential hypertension.
This is what the majority of people are diagnosed with.
90%, 85 to 90%, 90 to 95% of people are going to be diagnosed with this because this tends to develop very gradually. So this is your major segment of the population that has this issue. No discernible cause. Also what like medicine or science would say idiopathic, which means no idiot knows. Right.
So it takes a long time to develop. This is when we see the plaque build up in the arteries as well, because that also takes a long time to develop. That plaque gradually lays down.
So the second type of hypertension that we have is what we call secondary hypertension. Now, these are the things that these legitimately require medical intervention. Like no matter what your lifestyle is, no matter what your diet is, no matter what your nutrition is, no matter what your stress level is, these things are going to require medical intervention to make sure that you control this high blood pressure. These are things like, these are major problems. These are cancers. These are tumors. These are vascular problems that are
Congenital defects
that are presented at birth. But then these next two,
kind of a caveat.
bullet points 3 and 4. This is also things that we already know. Medications, cough and cold medications, pain relievers, birth control, and other prescription drugs. We all know this. Either all of us here in this room have experienced this, or we know somebody that's experienced this. You go to your doctor, you get put on a medication, and then you have another symptom. You have another side effect. And then you get on a medication for that.
Control that side effect. And then you get another medication to control that side effect. Before you know it, you're on 6 medications when all you came in for was high blood pressure.
Yeah. One of my favorite stories is from a patient that we have here. They're pretty worldly traveled. They go to many different countries every year. And this individual had to go to the hospital when he was in Germany. He wasn't feeling well, had to go to the hospital, saw a doctor. And the doctor goes, all right, you're American, give me your list of medications. What medications are you taking? And he goes, I'm not taking any medications. And the doctor goes, no, I need to know what medications you're taking. And it took him 10 or 15 minutes to convince this doctor that because he's American, he's not on any medications. He said, you're the first American that I've seen in the last year that is not on any medications. It's very hard to convince other countries and other doctors that we're not on medications because of this particular issue with side effects that would take place. In this particular issue with secondary hypertension, sometimes that is unavoidable. Right? We have this issue that definitely requires medication, and it just happens to be a side effect of that, that we need that blood pressure medication for. But we want to talk about the things that create the risk factors for essential hypertension and secondary hypertension. And I think a lot of these things, you're going to be like, oh, duh. Like I knew this, right?
Yeah, like age. Age is like, oh, I knew that. As you get older, your risk for developing high blood pressure or hypertension increases. And also, fun fact, men before age 64 are usually the ones that present with high blood pressure. After 64, switches to females. Wonder why.
That's because my wife stresses me out. That's an easy one.
After
Yeah.
65, people are retiring, they're spending more time together, and then what happens? The wives get stressed out.
Yeah.
That's what happens.
Pretty classic. So we have lack of exercise on here, too much salt, pregnancy, too much alcohol, stress, lower potassium levels, related to dietary issues, obesity, being overweight, family history, tobacco, certain chronic conditions. Now, the bulk of this slide here is lifestyle, right? The bulk of this slide is lifestyle. The things that you can't change your parents, right? Can't change your race and can't change your age, right? So these are things that contribute a necessity to that high blood pressure. But hereditary, our genes, the way that we are composed, actually only contributes about 40 to 45% of our blood pressure, of our high blood pressure risk. So that's 60 to 65% of the contributing factors that are lifestyle in nature, which is more than half, which is the majority, which I think is the important aspect to think about when we talk about high blood pressure.
Mm-hmm. So what can you do about it? So Mayo Clinic and us put together 10 things that you can do to help lower your blood pressure naturally. So the first one is losing weight. So fun fact, for every 1 kilogram or 2.2 pounds that you lose, your blood pressure has the ability to go down by 1 millimeter of mercury, or 1 point, which that'll be important later. So keep that in mind. Exercising regularly. So regular physical activity can lower your high blood pressure by 5 to 8 millimeters of mercury, or 5 to 8 points. 30 minutes a day is a general guideline. This can be walking. This doesn't have to be anything totally strenuous. Walking, swimming, jogging, strength training a few times a week. Just something to get your body moving, right? Eating a healthy diet. So whole foods, grains, whole grains, fruits, veggies, low saturated fats, lower cholesterols. All of that, following a healthy diet, can lower your high blood pressure by 11 millimeters of mercury, or 11 points. Yep. Again, keep in mind all of these points. That'll come back at the end.
And I love this slide because of these first three things: losing weight, exercise, and eating healthy diet. In the United States, just by living here as opposed to other countries, we have what's called a death tax. So our life expectancy for men in particular is 8 years less than other developed countries like Japan, for example. Women, it's a little bit higher. They live a little bit longer. They do less dumb things than men do. So it's about 6 years lower life expectancy. Now, this is a normal adult. This adult could be overweight, but it's still 8 years. Now, if we combined an adult that's overweight, an adult that does not exercise, an adult does not eat healthy, that goes to 15 years death tax. So instead of dying in Japan, instead of dying at 88 years old, you're now male, now dying in your 60s. Now, say we just add one of these things to that category, which will lower our risk of death and lower our risk of high blood pressure. If we just added 30 minutes of exercise a day, of moderate intensity exercise, meaning we get our heart rate above like 60% of our max heart rate, you will take that 15-year death tax and you'll shorten it back to that 8-year death tax. Now, if we add healthy eating, where we're also working on that blood pressure, we're also working on those other metabolic symptoms. And these two things kind of equate to like this lower weight loss. It just like happens to be like a very cool outcome of this. You're taking that 8-year death tax and you're shortening it to the same life expectancy of other countries in the world like Japan. So these three things are the absolute best things that you can do to, one, increase your life expectancy, to increase your life outcomes, and decrease that blood pressure.
And your quality of life.
Yeah. Because we all know that one of the top 3 leading causes of death in the United States is cardiovascular disease in nature. That's our heart attacks, that's our strokes, right?
So what else can you do? Reducing salt. This doesn't have to be like you cutting out salt completely. Salt or sodium is an essential nutrient you need to have in your diet. I'm not telling you to not have any at all. But even dropping it down to 2,300 milligrams a day or less can bring your high blood pressure down 5 to 6 millimeters of mercury, or 5 to 6 points down.
No canned soup.
Yeah, so read the food labels, try to avoid processed foods if you can. The easiest way to do that is cooking your own foods. That way you can control what goes into it.
Number 5 and number 6 are pretty self-explanatory in nature. We're lowering your alcohol consumption and smoking. Those are kind of beaten to our heads as a society at this point. Smoking kills, and the main thing that smoking does is it doesn't necessarily cause that plaque to get built up, but it causes that more serious one where the arteries start to get hard, right? And they don't allow for that expansion to take place.
And they constrict your blood vessels as well. And if we already have harder blood flow, we don't need a smaller space for it to go through.
This is why a lot of the symptoms that we experience with smoking, when we go and exercise or we go and try and walk up a flight of stairs, you get that like kind of chest pain, that acute angina, that pectoralis angina that takes place here. You're like, oh. And then you sit down, you rest, and it goes away. That's your blood, that's your arteries in your vascular system in your chest constricting, right?
Okay, so getting a good night's sleep. So it has been shown that getting fewer than 6 hours of sleep every night for several weeks can contribute to high blood pressure by several points or several millimeters of mercury. How many of us get less than 6 hours of sleep a night? So proud of you guys.
I did the last week.
You guys came to all of our other talks.
Yeah. We were in Las Vegas though, so I got less than 6 hours sleep.
I'm so proud. That was a test. Reducing your stress. So chronic long-term stress has been shown to increase high blood pressure. So what are some ways that we can decrease stress? I know some of you guys have come to our stress talks.
Don't watch the news.
Don't watch the news. Yeah. What else can you do?
Drive your sports car on the parkway.
Drive your sports car on the parkway.
Yeah.
Yeah. Get out in nature. Meditate. Yeah.
Dog will
Yeah.
get you out in nature.
Yeah. A lot of the things we already talked about too, right? Like getting enough sleep, eating healthy foods, moving your body. All that contribute to reducing stress.
And we already talked about 9, monitoring your blood pressure, making sure that you kind of have tabs on it. Obviously, a lot of these things that we deal with in our current lifestyle and in our current social setting allow us to track that very easily, but also make it very easy for us to let it get out of hand. We get busy with life. You have jobs, you have kids, you have dogs, you have things that happen. So the more you kind of keep your thumb on the pulse. But that's a good joke. The better you are going to be to prevent these issues. The number 10, get adjusted. We definitely want to make sure that as we get adjusted, the adjustment does several things. Obviously, like we all know that it helps us feel better. We don't have any pain associated with that. But there's a couple things that the adjustment does that are super powerful. One, it's going to restore that proper joint range of motion. If you restore that proper joint range of motion, then you just end up moving better. You want to get out and do that exercise. Walking up the stairs is easier. It's less taxing for you, right? When we do that adjustment on that particular area of the spine, whether it's the lower back or the mid back or the neck, you're taking that particular nervous system in that area, and you're allowing the muscles to just stop and relax and dissipate, right? So we get that decreased tension that happens in that area.
Mm-hmm. And of course, we couldn't leave today without talking about some supplements as well. So we talked about a lot of things those are level things. You can do that at home. I also wanted to bring attention to some supplements as well. So Standard Process has a ton of supplements. A lot of these you've probably seen from some other lectures that we've done because they work on multiple systems of your body. Some of our favorite kind of general supplements for heart health, Cataplex B Core and Cataplex B2. So they're both B vitamins. Your heart responds fastest compared to any other organ in your body to nutrients. B vitamins specifically help muscle health, and your heart is all muscle. So it's one of the first things that people start to notice when they start taking any kind of B vitamin is that they have better blood flow, they have more energy, and because their heart is actually working and pumping the blood better.
On this list at the very far left side, you have Cardio Plus. Now, this is Standard Process is like a very generic supplement for heart health. This does several things. Now, this has a couple glandular supplements in there. A lot of Standard Process products have glandular supplements, and what that is the actual dehydrated gland from a bovine, and typically a bovine animal. And what your body does is it takes that particular element of that supplement, and it allows to help rebuild the tissue that's in the body. It'll help rebuild the tissue that's in the body. But then if you already have these risk factors that increase like the abuse that happens to the heart, what this does, it actually acts like a decoy. And so it'll bring heart tissue into your body, and your body's going to attack that heart tissue instead of attacking your regular heart. So it acts as a decoy in this situation.
We also have Cyruta Plus. This is, think of like a scrub brush for your arteries. So this attacks that plaque buildup in your arteries, helps kind of eat away at that, helps clean out your arteries so you can have better blood flow. I also want to mention Cataplex B2 is a vasodilator. So taking those two together, Cyruta Plus and Cataplex B2, not only cleans out the arteries, but it allows that blood vessel to expand so we have better blood flow as well.
We have sample supplements, right?
We do. We do have samples that we'll give out today.
Yeah. The other one right here in the center is Circuplex. Now, just like that sounds, circulate. So this actually helps us vasodilate and get more blood flow to the area. This is indicated for like vasodilation, expands these blood vessels, allows for more blood flow to get to the area. This is our cold extremities. This is our stiff joints. I will give you a firsthand experience on what this is like over the next 20 days because I just started taking it. I'm having some like circulation issues that I don't know like what's going on. My hands get cold, my feet get cold, right? And so like I have blood, like I'm a big sissy when it comes to cold weather, and that's why like I get very cold extremities. So I started taking Circuplex to see if that helps. And I actually said something the other day that like I feel like it's helping. I've only been on it for like 2 weeks, so I'm pretty excited about that.
But with any of these, you're probably wondering like, well, which ones are good for me? Which ones do I need to take? Well, talking with us about your healthcare conditions, filling out a system survey so we can see the specific areas of your body that need support. And we can also check your blood pressure too at each of your visits. You cannot diagnose high blood pressure off of one reading. You could be stressed out one day and have high blood pressure on the cuff and be completely fine 20 minutes later. So it takes several times in a row. But a lot of these are really great just for general heart health. If you have specific questions on it, though, you can talk to any of us about it. We can give some more recommendations, more specific recommendations.
The last one that was on there is actually Antronex. And so we actually give that out for like antihistamine work with the body, headaches, and more circulation things. This is actually one of these supplements that you can keep in your supplement cabinet. I don't say your pill cabinet because that means prescriptions, but your supplement cabinet. For like if you have a headache, you can take this supplement. It'll have a same impact or same outcome of Tylenol, ibuprofen, or Advil, or any of the over-the-counter medications.
And it's good for your liver, unlike Tylenol and ibuprofen.
Tylenol does the opposite for your liver that Antronex does. Yeah.
Okay, so remember when I was talking about all those points leading up to it? Each 10 millimeters of mercury or 10-point reduction in high blood pressure reduces the risk for coronary heart disease by 20%, stroke by 27%, heart failure by 28%, and all-cause mortality or all-cause death by 13%. Only 10. And how many of those did we talk about? How many of those add up to? Like 20, 30 points?
Yeah.
If you did all of those things, dropped them like 20, 30 points, think about how much your risk would be decreased just from things that you can do every day.
And I think it's very much worth noting that whether you have had a coronary event or not had a coronary event, these numbers still apply as accurately as possible. Your risk of having a second coronary event, if you've had a first one, is obviously increased, right? But the more that you can work with your body to decrease that risk, the more that these numbers, 20%, 27%, 20%, 13%, add up, and they matter more, right?
But we hope that you guys got something from this. Hopefully you took a little piece away, things that you can add into your daily life. We're not saying you have to go change every single thing about yourself, but adding in one thing that takes down your high blood pressure by 2, 3, 4 points, it adds up over time, and that decreases your risk for heart disease. But we do have some heart supplement samples we'd like to give out to you guys today. You can try them out, see what you think. Really.
What we also want to offer and let you guys know is that any one of those 10 things that we discussed in terms of those are all lifestyle changes, right? Lifestyle changes are incredibly challenging to do. So we can help you guide you through those, whether it's like nutrition or whether it's diet. Like you're like, well, I want to change my diet, but I don't know how. We can work through that. I want to start exercising, but I don't know what's safe. I don't know what's proper for me to start doing. We can go through that, right? Stress techniques. We have a lot of breathing books I recommend. I love them. Like, it's awesome.
I'm like, I do all that. I'm losing a lot of weight, and my blood pressure is actually going up. And I'm like, and the doctor's like, it's stress. We've got to find something for you. I'm like,
Yeah. I think the worst advice somebody could ever give is like, just lower your stress.
Yeah, just lower it.
Yeah.
Then don't go to work.
That's literally my husband. That's all I have to get rid of. And the doctor's, my internist is like, well, if you know the perfect thing to get rid of stress that works for you, that's what it is. Because I'm still looking for my own perfect.
Yeah, and it's different for every single person.
Yeah. And sometimes these are just kind of like, I like talking out loud, and I like kind of like gaming things out in my head. Like if I'm not finding something that works, just like talking out loud to somebody and kind of like brainstorming, bouncing ideas off of. And so we can offer that as well with what we do.
Yeah. There was a time when they were really big on everybody's talking about garlic, take garlic capsules. But I never did go there because I like garlic and I need it. I think I'd rather get my nutrients if I can from my food.
Yeah,
But there's so
I
many
agree.
supplements out there, this for this and that for that, and you're not gonna, everything does something for some part of your body. But it gets very confusing, and I've kind of pared down the supplements, and because you don't need all of that if you're getting nutrition.
Absolutely.
But it does, and I do go with my doctor's guidance. There's certain things, cholesterol management. In other words, just precautionary cholesterol, because it stays it's okay, but he doesn't want it to get higher. But just there's so many things. Just awareness of it helps you. And when you go to the grocery store and you get supplements, it just helps you to be aware of what you're putting in your body and what the heck it's for, and not just throwing back vitamins saying,
No, I
"Hey,
agree.
I'm good to go. I
Yeah.
can go 4 hours sleep and I've had all my vitamins." It's all
Supplements are called supplements for a reason. They're supplemental to everything else that you're doing.
Yeah.
They're not going to fix everything for you if you're not already making the other changes.
Yeah, and we have a very intense blood pressure protocol based off of, is it essential hypertension, is something that in like lifestyle factors, like different things that you have going on, or that secondary hypertension. Now these protocols that we have and these supplements that we have, these aren't long-term things. Like these aren't long-term things that you should be or need to be or have to be taking. And if you have to take a supplement long-term, there's an underlying thing that's going on that we're not addressing, right? But in order to even just like think of like a Kickstarter, like I wanted to kickstart this, take a supplement, kind of help ease down to it, and then start to titrate off of that. That's kind of what these are for. The Cyruta Plus that's on there, that's something that you can take forever. That's an herb. You can take that forever. You can go buy it in the store, like the actual Cyruta plant, and cook with it and eat with it. This is just much more convenient in a pill form. I don't think Cyruta tastes very good, so I should rather get it in a pill. Because what these are actually the whole food products. So the Cyruta Plus is a medi-herb product, which is a nutraceutical, which is actually that herb encapsulated. So they just take that and they encapsulate it, and you can eat it that way. So some of these can be taken for a long time, and some of these can be taken for short time. And they just help to augment the things the better lifestyle choices that we're making. Doesn't have to be 100%, but consistent. Give me like a C. Give me like a C for chiropractic, like 70%. Oh my God. Yeah, that's what we're looking for, consistency.